Hi, my name is Emily, and today I'm going to be going over antibiotic-resistant syphilis. Syphilis is a sexually transmitted infection characterized by a syphilitic sore called a chancre. You cannot get syphilis from toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, or from sharing clothing or utensils. The people most at risk are gay and bisexual men, as well as Black people. In 2018, 34.7% of confirmed syphilis cases were among Hispanic and Black people, which is a striking percentage. That's a big chunk. The rate of syphilis infection in Black people is 4.7 times the rate among white people, which highlights an inequity in our healthcare system. So what exactly is syphilis? As stated, it's a sexually transmitted infection with a primary, secondary, latent, and tertiary stage. It's characterized by those chancres, which are round, small, and normally painless. These chancres can last between 3 and 6 weeks. The secondary stage is not only characterized by these chancres, but also by red or brown spots on the hands and feet, as well as swollen lymph nodes, sore throat, hair loss, headaches, weight loss, muscle aches, and fatigue. The tertiary stage is the most rare, but it is the most severe. This occurs if syphilis is left untreated. Where should testing be completed? Testing can be done in any place that handles sexual wellness, typically doctor's offices, community health clinics, health departments, and Planned Parenthood locations. The infectious window can last between 10 and 90 days, with an average incubation period of 21 days. The patient can then be contagious for up to 2 years without treatment. The CDC uses different diagnostic codes for different infectious agents. The patient is considered contagious in these diagnostic code sections 710 and 720. The final stage is late stage 755, where the patient is no longer contagious, but at that point, they're probably living with some pretty serious health concerns, which we'll get into momentarily. Now, as public health professionals, why is syphilis important to us? So, syphilis, first of all, is preventable. And first and foremost, as public health professionals, we strive to promote top-tier prevention strategies as well as educational materials to promote eradication and prevention of these agents. Syphilis, specifically during pregnancy, can cause some serious complications such as miscarriage, premature birth, stillbirth, and several other issues like low birth weight. Not only can this be passed from mom to baby, but also if it's left untreated during pregnancy, baby can experience lifelong issues with their eyes, ears, teeth, bones, and joints. That's why we really like to reiterate to pregnant women, get tested for syphilis at your first prenatal visit, at 28 weeks gestation, right? And then again right before delivery. Untreated syphilis can cause late syphilis, which can live in the body for years, which can then lead to neurosyphilis, which is an infection that affects the covering of the brain, the spinal cord, or the brain itself. It can also cause ottosyphilis, which causes hearing loss, or tinnitus, which is the ringing in the ears. Ocular syphilis can also occur, which can cause optic neuropathy, retinal vasculitis, interstitial keratitis, and blindness. Also, the treatment for syphilis is very, very simple. It's a single shot of benzene penicillin, and it treats the infection at all stages. How can we protect ourselves? So first and foremost, there's sexual abstinence. Having sex by using condoms and dental dams, being in a monogamous relationship. Again, if pregnant, make sure you're going in for your first visit, 28 weeks, and at the time of delivery, we're getting tested. And then again, asking your sexual partners to be tested for all STDs and STIs. Further considerations. So finally, we battle systemic health inequities in our society continually. Health inequities directly contribute to lifelong health outcomes. So what we want to focus on is increasing education, specifically around what we can do as public health professionals to combat this, right? And then while it is rare, syphilis can become resistant to antibiotics. Again, it's rare. The bacteria that causes syphilis is Treponema pallidum, and it is it's the mutated form of that bacteria. And these are the references. Thank you so much.